Ronell Nolan, President, CEO, Health Agents for America, coming to you live this Monday. Happy early Turkey Day. I hope everyone has a wonderful week and is able to spend some time with your family and friends. The first thing I wanted to talk about is an article you'll read about allowing MIWAs in California. It's by Wagner Law. And it says MIWAs allowed to continue large employer rating for small employers per new California state legislation. I know especially on the legislative calls, we've had several discussions about MIWAs. And I get several calls a year about whether certain states allow MIWAs. So very interesting information. Even if you're not from California, take a look at that article. The most important thing I want to share with you is just an update on our model notice. As you know, we've been working with Diceris Law on creating a computer program that would produce a model notice for HAFA and those agents and brokers across the United States that would like to purchase the program. We are working with Diceris Law on our final draft. It is now going to the computer program company to actually create the program. Our next step will be to allow our Commission Transparency Task Force to test it, to put in renewal information to see if we've answered all the questions that need to be answered and that it produces a form that works for our members. So we are moving forward. We plan to have something in your hands prior to December 27th. As you know, the law goes into effect 12/27. We have not received a delay nor any guidance from the Department of Labor to change those dates or that information. We have told the Department of Labor we will be prepared January 1st to go forward and adhere to the law. So I'm excited about the computer program. I'm excited about what HAFA is doing and how we're going to provide something for our members to use that's going to be easy to use and make sure that we're in line with all federal law. I have listened to several webinars from all different entities over the last month. I see nothing different from what HAFA has been saying from the get-go, from our conversations with CMS and Department of Labor. We've been spot on with what we've said and what we know. We are waiting for the final rules from CMS to let us know about the individual market and how that will be handled going forward on individual and short-term medical. But on the group side that is regulated by the Department of Labor, we have our attorneys working and reviewing and making sure that we are adhering to the law. One thing that was brought to my attention is there was a GA that said they did not feel that the Commission Transparency Notice should be signed, that constituted a contract. We are in conversation with our attorneys who do not feel like that constitutes a contract. You'll notice that some of the model notice that have gone out by some of the entities have signature requirements. We have to cover our bases. We have to prove that it was delivered in a timely manner, and that we provided the information we should have provided. So as far as our attorneys go, at this point, unless we receive some guidance to the contrary from the Department of Labor, our model notice will require a signature from the client and from the agent or broker. This Monday news is going to be fairly short as you are all working really hard on the marketplace open enrollment, the Medicare open enrollment, which will be ending fairly soon, and also mostly fourth quarter is complete. However, you are most probably working on first quarter renewals. So it's a busy time for us. Please reach out and let me know if you need anything I can help you with. I will let you know for those that were in Louisiana. I was told that the LSU game was supposed to be televised, the halftime. I know the game was televised. I do not think the halftime, as stated, was televised, but I was the first one to march on the field at the 50-yard line. So if you happen to see, it, that was me. And I had a wonderful time. I'm so glad that I did it. I will be in Key West with my sister for Thanksgiving, but I'm bringing my computer with me. So if you need me, please reach out. I will be working while I'm in Key West, taking care of you guys and taking care of the couple of clients that I have with the marketplace. I know many of you are struggling with those that have new competitors that have come into the market that have moved the needle on the second lowest silver. We are in conversation with CMS on how that has affected those in the market. In many cases, those that were paying $0 last year for a very robust plan, it will be paying $200 to $300 to $400 for the same plan. They do have other plans that are available. However, the networks are not as robust. So many of you are struggling to make sure that your clients are enrolled before 12/15, so they are not auto-enrolled into a plan that they cannot afford. Remembering that open enrollment does go until January 15th, but remember that those enrollments wouldn't go into effect until December 1st, by January 15th, by February 1st. So by January 15th, it's going to go into effect for February 1st. So that's going to be 1 month they're either in a plan they cannot afford or they do not have coverage for January. So very, very, very important that you pay attention if your clients are being auto-enrolled into a plan they cannot afford. Remember to touch every client. Remember to make sure that you adjust their income, that you make sure that their doctors are included in the new networks, that their medication is covered. I know you do your due diligence, and I'm proud and honored to represent some folks that are just the best of the best. HAFA does not represent fly-by-night agents and brokers. We represent the cream of the crop, the best of the best. And I am so honored to be your president CEO. Have a wonderful week, a wonderful Thanksgiving. And until next Monday, Ronell Nolan, President CEO, Health Agents for America.